Hello friends, today I am going to discuss with you a summary of Green-top Guideline number 20B, Management of Breech Presentation. Now the executive summary of recommendations. What information should be given to women with breech presentation at term? Women with a breech presentation at term should be offered external cephalic version unless there is an absolute contraindication. They should be advised on the risks and benefits of ECV and the implications for mode of delivery. Women who have a breech presentation at term following an unsuccessful or declined offer of ECV should be consulted on the risks and benefits of planned vaginal breech delivery versus planned cesarean section. What information about the baby should be given to women with breech presentation at term regarding mode of delivery? Women should be informed that planned cesarean section leads to a small reduction in perinatal mortality compared with planned vaginal breech delivery. Any decision to perform a cesarean section needs to be balanced against the potential adverse consequences that may result from this. Women should be informed that the reduced risk is due to three factors: the avoidance of stillbirth after 39 weeks of gestation, the avoidance of intrapartum risks, and the risks of vaginal breech birth, and that only last is unique to a breech baby. Women should be informed that when planning delivery for a breech baby, the risk of perinatal mortality is approximately 0.5 per thousand with cesarean section after 39 weeks of gestation and approximately 2 per thousand with planned vaginal breech birth. This compares to approximately 1 per thousand with planned cephalic birth. Selection of appropriate pregnancies and skilled intrapartum care may allow planned vaginal breech birth to be nearly as safe as planned vaginal cephalic birth. Women should be informed that planned vaginal breech birth increases the risk of low ABGAR scores and serious short-term complications, but has not been shown to increase the risk of long-term morbidity. Clinicians should counsel women in an unbiased way that ensures a proper understanding of the absolute as well as relative risks of their different options. What information should women having breech birth be given about their own immediate and future health? Women should be informed that planned cesarean section for breech presentation at term carries a small increase in immediate complications for the mother compared with planned vaginal birth. Women should be informed that maternal complications are least with successful vaginal birth. Planned cesarean section carries a higher risk, but the risk is highest with emergency cesarean section, which is needed in approximately 40% of women planning a vaginal breech birth. Women should be informed that cesarean section increases the risk of complications in future pregnancy, including the risks of opting for vaginal birth after cesarean section, the increased risk of complications at repeat cesarean section, and the risk of an abnormally invasive placenta. Women should be given an individualized assessment of the long-term risks of cesarean section based on their individual risk profile and reproductive intentions and counseled accordingly. What information should women having breech births be given about the health of their future babies? Women should be informed that cesarean section has been associated with a small increase in the risk of stillbirth for subsequent babies, although this may not be causal. What factors affect the safety of vaginal breech delivery? Antenatal assessment. Following the diagnosis of persistent breech presentation, women should be assessed for risk factors for a poorer outcome in planned vaginal breech birth. If any risk factor is identified, women should be counseled that planned vaginal birth is likely to be associated with increased perinatal risk and that delivery by cesarean section is recommended. Women should be informed that a higher risk planned vaginal breech birth is expected where there are independent indications for cesarean section and in the following circumstances: hyperextended neck on ultrasound, high estimated fetal weight more than 3.8 kg, low estimated weight less than 10th centile, footling presentation, evidence of antenatal fetal compromise. The role of pelvimetry is unclear. Skill and experience of birth attendant. The presence of a skilled birth attendant is essential for safe vaginal breech birth. Units with limited access to experienced personnel should inform women that vaginal breech birth is likely to be associated with greater risk and offer antenatal referral to a unit where skill levels and experience are greater. Intrapartum assessment and management of women presenting unplanned with breech presentation in labor. Where a woman presents with an unplanned vaginal breech labor, management should depend on the stage of labor, whether factors associated with increased complications are found, availability of appropriate clinical expertise, and informed consent. Women near or in active second stage of labor should not be routinely offered cesarean section. Where time and circumstances permit, the position of the fetal neck and legs and the fetal weight should be estimated using ultrasound, and the woman counseled as with planned vaginal breech birth. All maternity units must be able to provide skilled supervision for vaginal breech birth where a woman is admitted in advanced labor, and protocols for this eventuality should be developed. What is appropriate intrapartum management of the term breech? Are induction and augmentation appropriate? Women should be informed that induction of labor is not usually recommended. Augmentation of slow progress with oxytocin should only be considered if the contraction frequency is low in the presence of epidural analgesia. What is the role of epidural analgesia? Women should be informed that the effect of epidural analgesia on the success of vaginal breech birth is unclear, but that it is likely to increase the risk of intervention. What fetal monitoring should be recommended? Women should be informed that while evidence is lacking, continuous electronic fetal monitoring may lead to improved neonatal outcomes. Where should vaginal breech birth take place? Birth in a hospital with facilities for immediate cesarean section should be recommended with planned vaginal breech birth, but birth in an operating theatre is not routinely recommended. What guidelines should be in place for the management of breech birth? Women should be informed that adherence to a protocol for management reduces the chances of early neonatal morbidity. The essential components of planned vaginal breech birth are appropriate case selection, management according to a strict protocol, and the availability of skilled attendants. Management of the first stage and passive second stage. Adequate descent of the breech in the passive second stage is a prerequisite for encouragement of the active second stage. What position should the woman be in for delivery during a vaginal breech birth? Either a semi-recumbent or an all-fours position may be adopted for delivery and should depend on maternal preference and the experience of the attendant. If the latter position is used, women should be advised that recourse to the semi-recumbent position may become necessary. What are the principles for the management of active second stage and vaginal breech birth? Assistant without traction is required if there is delay or evidence of poor fetal condition. All obstetricians and midwives should be familiar with the techniques that can be used to assist vaginal breech birth. The choice of maneuvers used, if required, to assist the delivery of the breech should depend on the individual experience, preference of the attending doctor or midwife. Management of the preterm breech. How should preterm singleton babies in breech presentation be delivered? Women should be informed that routine cesarean section for breech presentation in spontaneous preterm labor is not recommended. The mode of delivery should be individualized based on the stage of labor, type of breech presentation, fetal well-being, and availability of an operator skilled in vaginal breech delivery. Women should be informed that cesarean section for breech presentation in spontaneous preterm labor at the threshold of viability 20 to 25 plus 6 weeks of gestation is not routinely recommended. Women should be informed that planned cesarean section is recommended for preterm breech presentation where delivery is planned due to maternal and or fetal compromise. How should labor with a singleton preterm breech be managed? Labor with a preterm breech should be managed as with a term breech, where there is head entrapment, incision in the cervix, vaginal birth, or vertical uterine incision extension. Cesarean section may be used with or without tocolysis. Management of the twin pregnancy with a breech presentation. How should a first twin in breech presentation be delivered? Women should be informed that the evidence is limited but that planned cesarean section for a twin pregnancy where the presenting twin is breech is recommended. Routine emergency cesarean section for a breech first twin in spontaneous labor, however, is not recommended. The mode of delivery should be individualized based on cervical dilatation, station of the presenting part, type of breech presentation, fetal well-being, and availability of an operator skilled in vaginal breech delivery. How should a second twin in breech presentation be delivered? Routine cesarean section for breech presentation of the second twin is not recommended in either term or preterm deliveries. What organizational and governance arrangements should be in place to support a routine vaginal breech delivery service? Simulation equipments should be used to rehearse the skills that are needed during vaginal breech birth by all doctors and midwives. Guidance for the case selection and management of vaginal breech birth should be developed in each department by the healthcare professionals who supervise such births. Adherence to the guidelines is recommended to reduce the risk of intrapartum complications. Departments should consider developing a checklist to ensure comprehensive counseling of the woman regarding planned mode of delivery for babies presenting by the breech. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.